Look at your fingernails right now. Press down firmly on one of them for about 2 seconds and then let go. Watch how quickly the color comes back. What you just did is something cardiologists use to assess circulation in a matter of seconds without a single piece of equipment. And what that simple test reveals, along with 3 other visible nail signs, can tell you something that most adults over the age of 60 are never told. Your nails are quietly recording what your heart and your blood vessels are doing every single day. The problem is that almost nobody is ever taught how to read them, and after the age of 60, when cardiovascular problems tend to develop quietly, without dramatic symptoms, without warning, until something serious happens, the signs that appear on your nails become one of the few warning systems that does not require a hospital visit to read. I am Dr.Michonne, and after more than 2 decades focused on preventative cardiovascular health for adults over 60, I want to walk you through 4 specific nail signs that have been linked in medical research to heart attack risk, stroke risk, and serious circulation problems. The 4th sign is the one I most want you to see before this video ends. It is one you can check in about 3 seconds, and most people are genuinely surprised by what they find. Before we go any further, drop your age in the comments right now and tell me whether anyone in your family has ever had a heart attack or a stroke, because your answer is going to be relevant to how seriously you should take everything we are about to cover. And if this kind of content is something you find genuinely useful, a quick like really does help me keep bringing it to you. To fully understand why these 4 signs matter so much after the age of 60, you need to understand something about what your nails are actually doing inside your body. Your nails grow from a structure called the nail matrix, a layer of living cells just beneath the base of each nail. Those cells are in constant contact with your bloodstream. They respond to changes in oxygen levels, in circulation quality, and in the health of the smallest blood vessels in your body. The capillaries beneath your nail bed are some of the tiniest blood vessels you have, and because they are so small, they are almost always the very first to show signs of trouble when your cardiovascular system begins to struggle. For someone in their 30s, the heart and blood vessels have enormous reserves, and the body can mask early dysfunction for a long time without anything surfacing on the nails. But after 60, those reserves narrow, not because the body is broken, but because it has been running faithfully for 6 decades, and the margin for quiet dysfunction is thinner than it used to be. Think of your nail bed as a window into the smallest blood vessels in your body. When those vessels begin to struggle, the nails are often the first place that struggle becomes visible. Your doctor is not necessarily examining your nails during a standard 15-minute appointment, because there is only so much ground a doctor can cover in that time. Nail examination, unless something is visually alarming, rarely makes the priority list. But the information exists in medical literature. It just does not always travel from the clinical setting to the person who actually needs it. That is what I am here to change. Let me walk you through these 4 signs one by one. Stay especially present for number 4, because it is the one almost nobody has been told to look for. Sign number 1, cyanosis. There is an important distinction here that most people have never been taught, and it changes how urgently you need to respond to what you see. Cyanosis refers to a bluish or purplish tint visible through the nail bed, especially near its base. But there are actually 2 distinct types, and they mean very different things. The first is called peripheral cyanosis. This is when the bluish color appears only on your fingernails and perhaps your toenails. Your lips, your tongue, the inside of your mouth all look normal and pink. Peripheral cyanosis develops gradually, over weeks or months. It is your body telling you that circulation to the extremities is not what it once was. It is a warning, but not an emergency. The second type is central cyanosis. This is when the bluish color appears not just on your nails, but also on your lips, your tongue, and the inside of your mouth. Central cyanosis is a medical emergency. It means the blood leaving your heart is not carrying enough oxygen. It requires immediate medical attention. Do not wait. What is happening biologically in both cases is that the blood reaching those tissues is not adequately oxygenated. In peripheral cyanosis, the problem is typically with circulation. In central cyanosis, the problem is typically with the heart or lungs themselves. Research has found strong associations between persistent peripheral nail bed cyanosis and conditions including early-stage heart failure, unrecognized heart valve problems, and chronic lung diseases that over time place serious strain on the heart. The reason this matters so much after 60 is that heart failure prevalence rises sharply with age, and it remains one of the most frequently underdiagnosed conditions in the older adult population. Early-stage heart failure often produces no dramatic symptoms, no chest pain, no collapse, just a slow, quiet decline in how efficiently the heart is working, while the body compensates until the day it simply cannot compensate anymore. Let me share a story with you. A retired teacher named Albert from Sarasota, Florida, had been noticing for nearly a year that his nails looked slightly purplish at the base, especially in the mornings and after he had been sitting still for a while. He told himself it was the cold weather. He told himself it was just poor circulation, something he assumed came with getting older. It was only when his daughter visited and commented on the color of his nails that he finally brought it up at his next routine checkup. His doctor examined him carefully, ordered an echocardiogram, and discovered early-stage heart failure, still highly manageable with the right medication and lifestyle adjustments. Albert avoided a hospitalization that almost certainly would have happened within the following year. The practical takeaway is straightforward. Examine your nails under good, natural daylight near a window. If the color near the base of your nail bed looks bluish or purplish, and that color does not change when your hands warm up, bring it to your doctor's attention. Ask specifically whether an echocardiogram might be appropriate given your age and your other risk factors. And if you ever see bluish color on your lips or your tongue alongside your nails, do not wait for an appointment. That is an emergency. Have you ever noticed any color change in your own nails? Type the word heart in the comments right now if you want me to do a full deep dive on heart failure warning signs you can spot at home. I read every comment, and the topics that matter most to you are the ones I cover next. Sign number 2, brittle and slow-growing nails. This is one that almost everyone over 60 dismisses as simply part of getting older. What I am describing is nails that break easily, that peel in layers, that split vertically along their length, or that simply do not seem to grow the way they used to. You used to need to trim them every 2 weeks. Now it seems like they barely change from month to month. What is happening here is that the nail matrix is not receiving the steady supply of nutrients and oxygen-rich blood it needs to produce healthy new nail tissue. And one of the most common reasons for that in older adults is a condition called peripheral artery disease, often shortened to PAD. Peripheral artery disease is what happens when the arteries carrying blood to your extremities, your arms, your legs, your hands, become narrowed due to plaque buildup. Here is the part that most people are never told. The same plaque that causes heart attacks when it forms in the arteries of the heart, and the same plaque that causes strokes when it forms in the arteries leading to the brain, is the exact same kind of plaque that builds up in the arteries leading to your fingertips. Plaque in one artery means plaque is very likely forming in others. That is why peripheral artery disease is considered one of the strongest predictors of future heart attack and future stroke. And here is what surprises most people. PAD is often completely silent for years before any dramatic symptom appears. But there is a specific pattern of warning signs that tends to appear together, and recognizing the combination matters more than recognizing any single sign alone. The pattern is this: brittle, slow-growing nails, cold hands and feet that take a long time to warm up, and cramping or heaviness in the legs when walking, especially uphill or upstairs, that goes away when you stop and rest. This last symptom has a specific clinical name. It is called claudication, and it is one of the most reliable signs of significant arterial narrowing. If you recognize all three of these things together, the brittle nails, the cold extremities, and the leg cramping that comes with walking and resolves with rest, that combination is genuinely worth a conversation with your doctor. Let me tell you about Margaret from Burlington, Vermont. Margaret had been an avid gardener her whole adult life. When her nails started becoming brittle and splitting easily in her late 60s, she blamed it on years of working with her hands in the soil and on the dry winter air. She tried supplements. She tried nail treatments from the drugstore. Nothing helped. What finally prompted her doctor to look more closely was something she mentioned almost as an afterthought during a routine visit. She said her legs felt heavy when she walked uphill, something that had been getting slowly worse over about 18 months. Her doctor performed a simple test called an ankle brachial index, which compares blood pressure at the ankle to blood pressure at the arm. The result confirmed moderate peripheral artery disease. With aggressive lifestyle changes, a structured walking program, and the right medications, Margaret reduced her cardiovascular risk dramatically. Her brittle nails had been telling the story for nearly 2 years before anyone caught it. The practical takeaway is this: if your nails have become noticeably more brittle in the last 1 to 2 years, and you have any sensation of heaviness, cramping, or fatigue in your legs when you walk, ask your doctor specifically about an ankle brachial index test. It is simple, non-invasive, and it can catch peripheral artery disease at a stage where intervention makes an enormous difference. Sign number 3, the capillary refill test. This is the one I mentioned at the very start of this video, and I want you to do it with me right now. Here's how it works. Hold your hand at the level of your heart. Pick any fingernail. The index finger works well. Press down firmly on the nail with the thumb of your other hand for about 2 seconds. You will see the nail bed turn white as the blood is pushed out of the tiny capillaries underneath. Now let go and start counting. 1001, 1002. Watch how quickly the normal pink color returns. In a healthy adult with good circulation, that pink color comes back in under 2 seconds. If it takes 3 seconds or longer, especially consistently across multiple fingers, that is a sign that the smallest blood vessels in your body are not refilling normally. There is also a second test you can do alongside this one. Press the back of your hand gently against your forehead or your cheek. Your hand should feel close to the same temperature as your face. If your hands consistently feel noticeably cooler than the rest of your body, even in a warm room, that is another meaningful marker of reduced peripheral circulation. Doing both tests together gives you a much fuller picture than either one alone. What the refill test is measuring biologically is the speed at which your microvascular system, the network of your tiniest blood vessels, recovers from pressure. Slow refill means that circulation in those small vessels is sluggish, and research has linked persistently slow capillary refill in adults over 60 to a range of cardiovascular concerns, including reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. The microvascular system is almost always where cardiovascular trouble shows up first, because the small vessels have less reserve than the larger arteries. One important note before you worry: if your refill is borderline, around 2 to 3 seconds, that alone is usually not cause for alarm, especially if your hands are cold or you are taking certain medications. Some blood pressure medications and beta blockers can slow capillary refill slightly without indicating any underlying problem. Repeat the test in a warm room with warm hands. If it is still consistently 3 seconds or longer across multiple fingers, that is when it becomes meaningful. Let me tell you about Robert from Topeka, Kansas. Robert had watched a health program one evening and decided to try the capillary refill test on himself. He counted nearly 5 seconds before the color returned on his index finger. He tried again on his thumb, his middle finger, his other hand. Same result every time. The next morning he called his doctor's office and described what he had found. His doctor asked him to come in, performed a full cardiovascular workup, and discovered undiagnosed atrial fibrillation, a heart rhythm problem that is one of the leading causes of stroke in older adults. Robert was started on appropriate therapy that, according to current cardiology literature, likely prevented a major stroke within the following 12 months. The practical takeaway is to actually do the test, right now, before this video ends. Do it on at least 3 different fingers in a warm room with warm hands. If your refill consistently takes 3 seconds or longer, write that down and bring it to your next medical appointment. Ask specifically whether a cardiovascular evaluation, including an EKG and possibly an echocardiogram, would be appropriate. Tell me in the comments how many seconds your refill took. I read every single reply. Sign number 4, changes to the lunula. And here is why this one earns the final position. Look at the base of your nail right now, just above your cuticle. Do you see a small, whitish crescent shape, almost like a half moon sitting at the base of the nail? That is the lunula. It is the visible portion of your nail matrix, the part where new nail tissue is being formed in real time. And the lunula is one of the most overlooked diagnostic signals in the entire human body. Here is something most people are never told about the lunula. The pattern of which fingers have visible lunulas matters as much as whether they are there at all. In a healthy adult, the thumb and the index finger almost always have a clearly visible lunula. The middle finger usually does. The ring finger sometimes does. The pinky often does not, and that alone is completely normal. If your pinky has no visible lunula but your other fingers do, that is not a concern. What is concerning is when the pattern changes. When lunulas you used to see on your thumb and index finger have disappeared. When lunulas across all your fingers have become barely visible. Or when the color of your lunula has shifted to something other than the normal pale white. The color shifts are particularly telling, and each one points in a different direction. A reddish lunula has been associated in clinical research with congestive heart failure and with rheumatic conditions affecting the heart. A bluish lunula can suggest the same oxygen and circulation problems we discussed earlier with cyanosis. A very pale lunula that has nearly faded into the rest of the nail can suggest anemia, which has its own significant connection to cardiovascular strain. The reason this deserves the final position in today's video is that the lunula is something almost no one is taught to examine, and yet it is one of the most accessible, visible signals your body offers. Most people have never been told to look at the base of their nails for anything other than signs of infection, and so a sign that could have prompted a conversation with their doctor goes unnoticed for years. Let me share one more story. A grandmother named Clara from Asheville, North Carolina, was 72 years old and had been generally healthy her entire life. During a phone call with her daughter, who happened to be a nurse, she mentioned, almost as a joke, that the little white half-moons on her fingernails seemed to have completely disappeared. She could not even remember when she had last seen them. Her daughter encouraged her to bring it up at her next physical. Clara did, somewhat reluctantly because she felt embarrassed mentioning her nails. Her doctor took it seriously, ordered a complete blood count and a cardiovascular risk assessment. The blood work revealed significant anemia that had been developing slowly for months. The cardiovascular workup revealed early signs of strain on her heart. Both conditions were addressed before they progressed to anything that would have caused a major event. The lunula change had been the first observable sign, and it might easily have gone unnoticed for another 2 or 3 years. The practical takeaway is simple. Look at your thumbs and index fingers right now under good, natural light. If your lunulas are entirely missing across most of your fingers, if they have noticeably shrunk in recent months or years, or if they have changed color, bring it up at your next medical appointment. Ask specifically for a complete blood count and a cardiovascular risk assessment. Now that we have covered all 4 signs, let me give you something practical. Because knowing something and acting on it are 2 different things, and I want to close that gap for you today. Start right now. Take both of your hands to a window with good natural daylight. Examine each nail. Note the color of the nail bed. Note whether you see any bluish or purplish tint. Note whether your nails feel brittle or look like they have been growing slowly. Do the capillary refill test on at least 3 fingers and time it carefully. Look at the base of each nail for the lunula and note which fingers have visible ones and which do not. Take a photograph of both hands. Having a visual record over time is genuinely valuable because changes that are gradual are difficult to remember accurately. This week, if anything we covered today matched what you observed on your own hands, write it down. Note the specific sign, which finger showed it, and roughly how long you have noticed it. Bring that written note to your next doctor's appointment. Within the next 30 days, if you observed 2 or more of these signs together, do not wait for your annual physical. Call your doctor's office, describe what you have seen, and ask whether a nurse can help you determine whether you need to be seen sooner. And please do not diagnose yourself based on any single sign in isolation. What matters is the full clinical picture, including your medical history, your current medications, your other symptoms, and what your doctor finds on examination. The purpose of today's video is to make you a more informed, more prepared participant in that conversation, not to replace it. Here is what I want to leave you with. Your body has been communicating with you your entire life. It has been sending you signals, some loud, some quiet, every single day. And the remarkable thing about being over 60 is that you have more context, more lived experience, and more access to medical support than at any other point in your life. The decades beyond 60 are not a time when meaningful health changes become impossible. Research consistently shows that early detection and informed attention to these kinds of signals can dramatically alter outcomes, even in the later decades of life. The nails you looked at this morning, and perhaps dismissed as nothing interesting, may be the most accessible diagnostic window your body has given you. You just needed to know how to read them, and now you do. If this video gave you something real today, please subscribe to this channel. It is genuinely the best way to make sure you never miss what comes next. And if someone you love could benefit from knowing these 4 signs, a partner, a sibling, a dear friend, please share this video with them. The next person you forward this to may be the one who notices something on their own hands tonight. I will see you in the next video.